Some of the biggest things is whether or not there's some concern for infertility. If there's been multiple partners throughout the years without any pregnancy, without any sort of prevention, we know that about 35% of couples that struggle with infertility, there's going to be a male component to it. For sure, if you're with a partner that's under the age of 35 and you've been trying for a year to conceive, that is a time that we would recommend coming in for evaluation. If you have a partner that's over the age of 35, 6 months is the time that we recommend evaluation. It's important to say that we do recommend evaluation of both sides because we know that it sort of takes two to make that process work. We do recommend evaluation on those that are undergoing some sort of testosterone therapy because that can affect sperm parameters. And anyone that's struggled with recurrent miscarriages or losses. And for sure someone who's had a prior vasectomy that wants to become pregnant again. One of the most important things is to have a discussion. We want to understand a little bit of their background, what their general health is, what their reproductive health has been throughout their lifetime, any significant illnesses, things that may potentially affect the sperm parameters. That being said, we also need a semen analysis. The recommendation is that if that's abnormal to potentially repeat it, but that's the best way that we have to sort of guide what may be happening. There may be some blood work that we get as well, but traditionally we start with the semen analysis. In the history portion, we're definitely looking for anything that might have impacted the reproductive health in their lifetime. So mumps is one of the childhood illnesses that seems to impact fertility, so wondering if that had any effect. But the biggest one is environmental things. So smoking, alcohol consumption, caffeine consumption is what we're looking for from a history perspective, more specifically, whether or not they're on testosterone therapy, because that can play a big role. As far as the semen parameters, there's sort of 4 criteria that we're looking for. One is volume. That lets us know, are we dealing with a production issue or maybe a more obstructive issue? The other one is motility. How many of those sperm are motile? That's really important. The other one is the concentration of sperm in that volume. That lets us know, is intercourse alone going to provide the best outcome, or do we need to do something different? And then probably the most important criteria that we look at, and it's sort of a specialized test, is something we call strict criteria morphology. It's just an assessment of how many sperm have the perfect shaped head and is associated with fertilization rates. And so that's one of the criteria that we're most interested in, for sure. Traditionally, we see people that are struggling with fertility, but we do know that people that struggle with fertility and have abnormal semen parameters are more predisposed to health conditions, primarily through some sort of testosterone deficiency. We see an increase in testicular cancers, we see an increased risk of that, heart disease, kidney disease, some of these other lifestyle things seems to be associated with infertility and abnormal sperm parameters. So a lot of it is dependent on the semen analysis. If we're dealing with, say, no sperm in the specimen, we have to decide whether or not it's a production issue or an obstructive issue. If it's an obstructive issue, like someone's had a vasectomy, there are ways that we can try and extract the sperm where it's being produced and use that. We don't get large quantities, so we usually have to do something like IVF for those patients. If we're dealing with a production issue, there are some medicines that we can use to sort of help jumpstart the body's natural production of sperm. If not, there's something that we can give that simulates the body's production. If we're dealing with just low counts, not truly absent, then the recommendation is to try something like an intrauterine insemination or something like in vitro fertilization to maximize the potential of the sperm. If we're dealing with something like recurrent miscarriages or recurrent losses, there are some things that we can do in the laboratory to try and select out the best quality sperm and utilize those, and that may have some impact on that.